Today we are going to talk about beta-lactam antibiotics, and particularly we'll focus on the cephalosporins. In beta-lactam antibiotics we'll focus on the cephalosporins. So, in introduction we should know what is meant by beta-lactam antibiotics. This group contains penicillins, cephalosporins, monobactams and carbapenems. All these drugs are called as beta-lactam antibiotics because there is a beta-lactam ring in their chemical structure. Beta-lactam ring is attached to the structure of all these antibiotic and hence the name beta-lactam antibiotic. These antibiotics, they are frequently prescribed for both prophylactic purpose and for the curative purpose or therapeutic purpose. Means these beta lactam antibiotics are used for prophylactic and therapeutic purpose both. But the problem with this beta lactam antibiotic is the development of bacterial resistance, and it remains a challenge while treating the various infections. Now we have seen the beta lactam antibiotics. We'll see the classification, how they are classified. Currently, four groups of beta-lactam antibiotics have been used. Four groups means first is the penicillin that we have already discussed. They are basically classified into natural and semi-synthetic penicillins. In today's lecture, we'll concentrate on cephalosporins, and in beta-lactam antibiotics, there is carbapenems in which there is imipenem and meropenem, and monobactam which contains aztreonam. So this is how we classify beta-lactam antibiotics. Now in today's lecture we'll concentrate on cephalosporins. So cephalosporins, these are the semi-synthetic antibiotic with a beta-lactam ring. As you can see, there is a beta-lactam ring, four-membered beta-lactam ring. This is what is four-membered beta-lactam ring. Okay. So these cephalosporins, they are derived from the cephalosporin C and which is obtained from a fungus cephalosporium. They are obtained from a fungus cephalosporium. And the nucleus is consist of beta-lactam ring. The nucleus is consist of beta-lactam ring fused to dihydrothiazine ring. There is a four-membered beta-lactam ring which is fused to or attached to dihydrothiazine ring. And side chain at position 7 of beta-lactam ring altering the spectrum of activity. If we change the side chain at position number 7, so what will happen? It will change the spectrum of activity. It will change the spectrum of activity. And at position 3 of dihydrothiazine ring, it will affect the pharmacokinetics. It will affect the pharmacokinetics. Means if we alter the position 7 of beta lactam ring, it will alter the spectrum of activity, and dihydrothiazine ring position number 3, it will affect the pharmacokinetic properties of cephalosporins. Now the very important and very difficult thing to remember is the classification of cephalosporins. Classification of cephalosporins. How they are classified? On the basis of spectrum of activity. On the basis of spectrum of activity. So we have first generation, second generation, third generation, fourth generation, and fifth generation also that we'll see. Now they are effective against gram negative, and the newer generations they are effective against gram positive also. Okay, so first of all we'll see the classification which is given in the KD Tripathi. Okay, in the first generation, they are classified on the basis of oral and parenteral. Oral and parenteral. In the oral, there is a cephalexin, cefadroxil, and the parenteral one is a cefazolin. Cephalexin, cefadroxil, and cefadroxil. Okay. Now in the second generation, again we have oral and parenteral. There is a cefaclor, cefuroxime and cefprozil. In the parenteral, again there is a cefuroxime is available as oral and parenteral, and cefoxitin, which is available parenterally. Now in the third generation, which is most commonly used generation nowadays, the third generation drugs are used very commonly. In that, oral is cefixime, right? Cefopodoxime, cefdinir, ceftibutane, ceftamate. Then parenteral, cefotaxime, ceftriaxone. The ceftriaxone is used very commonly. Ceftazoxime, ceftazidime, cefoperazone. They are used parenterally. Okay. Now in the fourth generation, there are only two drugs which is used parenterally, cefepime and cefepirone. Okay. Now you have seen it is very difficult to remember. So that's why what we have done, we have make the classification very simple. How will you remember the whole classification of cephalosporin? Just by remembering few things. The first important thing, the drugs that have FA or PHA or PHRA in their names, they are in the first generation. Okay, as you can see, the drugs which are having FA, FA, or as you can see here in the red line, the drugs which have FA or PHA or PHRA in their spelling, they will considered as a first generation. The only exception is the cefaclor. The only exception is the cefaclor, because in the spelling of cefaclor there is a FA, but still it is considered as a second generation. Now, the drugs which ends with IME, ONE or TEN, they are third generation except cefuroxime, which is a second generation drug. Cefuroxime, which is a second generation drug. There is only one exception. The drugs which ends with IME, as you can see, IME like cefexime, ceftazidime, cefotaxime, all they are ending with the IME, or ceftriaxone, or there is a ceftibutane. All they are considered as a third generation cephalosporin, except cefuroxime is a second generation. Now in the fourth generation, the drugs which are having PI, pimepirone, cefepime, cefepirone, they will considered as a fourth generation, PI in their spelling. And in the fifth generation, ROL is common in spelling, ceftobipirol and ceftaroline. ROL is common, they will considered as a fifth generation. Pimepirone, fourth generation. IME, ONE or TEN, third generation. FA, PHA or PHRA, first generation. And there is a exception, cefaclor and cefuroxime. All the remaining drugs like cefoxitin, cefprozil, cefotitan, they will be grouped as a second generation. So this is how you can remember the classification of cephalosporins. Now we'll see the mechanism of action in a next slide. Mechanism of action in a next slide. They are all bactericidal in nature, bactericidal antibiotic. The mechanism of action is similar as penicillin because all they are beta-lactam antibiotics. They act by inhibiting the bacterial cell wall synthesis, but the difference is there are different proteins unlike penicillin binding proteins. Proteins are different. In penicillins, they have penicillin binding protein. In cephalosporin, the proteins are different. Penicillin binding protein 1, penicillin binding protein 2 or 3, the proteins are different, but the mechanism of action will remain same.